We're being called to a 51-year-old male complaining of lumbar back pain. All vitals are within normal bounds.
Hello, my name's Aidan.
Hi there.
What seems to be the problem today?
I've hit my back in the garage.
Okay. So what were you doing?
I was picking up this heavy box and I twisted.
Okay. And the pain came on straight after that?
Yes, it did, yeah.
Have you done anything like this before?
Yeah, a couple of times, a few years back.
Okay.
Yeah, it's been pretty good up until now.
Right. And so when exactly did you do this?
Sorry?
When exactly did you hurt your back, sorry?
It was about an hour ago.
Okay. And what would you describe the pain as?
Oh, it's sort of there constantly, but it gets really sharp if I move.
Okay.
Mm.
And where exactly is the pain?
Oh, right down the bottom here.
Right down the bottom of your back?
Yeah.
Okay. And on a scale of 0 to 10, 10 being the worst pain you've ever felt and 0 being no pain at all, what would you describe the pain as?
Well, just laying here, it's about 6 out of 10, but if I move, it goes up to 9 out of 10.
Okay.
Just, really sore.
Right, so I just need to assess your back, okay? Is that alright?
Mm-hmm.
Right. So if I could, are you able to just lie on the side?
Oh, it's pretty hard.
Okay, I might just...
Oh, God, that hurts.
So, while you're up here, you're able to eat. Is that alright?
Sorry?
Are you able to eat? We can give you some pain relief.
Oh, yeah, okay.
Yeah, so how much do you weigh?
Oh, about 85 kg.
Okay, so we're going to give you 1.5 grams of paracetamol and 600 milligrams of ibuprofen.
Yeah.
Okay, so we'll get that to you now. We'll get you a glass of water. We'll do our drug checks as well. We'll document this on the PRF, what time we've given it.
Yeah.
Okay, so now he's had his pain relief. We're just going to feel your back. Is there any pain up here?
No.
Okay. And it's down here, is it?
Yeah, just a wee bit lower. Yeah, just there.
Right there?
Yeah, yeah.
Okay, and is it out here as well?
No, just in the centre.
What about up here?
No.
Okay. So you can lie back down now.
Oh.
We'll see how the pain's going in a couple of minutes, and if it's still really bad, we'll give you some tramadol as well, okay? Do you have any other pain anywhere else?
No.
Okay. Because you've got some back pain, I do need to just check your legs, okay? So, can you just tell me if there's any abnormal sensation down your legs? Can you feel that?
Yeah.
Yeah. Does that feel normal?
Yeah, I feel all that.
Okay. What about on this side?
Yeah. Feel that.
Feel that?
Yeah.
Yeah. Okay. Are you able to raise your knees? Right, I'm gonna. So just raise your left knee.
Oh, that hurts a bit.
Okay. And what about raise your right knee?
Yeah.
Okay. Are you able to raise your left leg completely?
Yep.
And raise your right leg completely?
Yep.
Have you been able to walk?
Well, I walked in here, no problem. It's just that standing up or lying down is much better for the pain. Sitting, I just can't do.
Okay. So rest is better for the pain, and it does sound like this is a mechanical injury that you've had. So I'm just going to assess your feet as well. So can you feel that?
Yep. Can
you pull against my hand?
Yep.
Yeah, and can you push against my hand?
Yep.
And the other side as well, pull against my... Yep, and push.
Yep.
Okay, that's normal. So there's no difference in the power between the legs. The temperature is the same, colour is the same, pedal pulses are both present. And we'll just take capillary refill time. And that's the same on both legs and less than 2 seconds. So because it's mechanical pain, we are able to leave you at home. I'm just going to go through my red flags just to exclude any serious illness or injury, okay?
Yeah.
So have you had any loss of bladder or bowel control?
No.
No. We've checked your temperature, it's not greater than 38 degrees. Have you felt any shakiness today?
No.
Okay. So no rigours?
No.
Our vital signs are all normal. Does not have any pain in the thoracic spine or chest. There is no abdominal pain or tenderness. So, can we...
That's fine.
That's fine, yep. There's no altered sensation and or power in both legs. Do you have any weird feeling sort of in your tailbone? So...
No, what do you mean by weird?
Just any difference in sensation?
No.
Okay. And you're able to walk?
Oh, yeah, I walked in here, but...
Yeah. Do you think you could walk now?
Oh, yeah, if you got me up.
Okay. I'm just going to check your pain score. Out of 10 again, what would the pain be?
Well, it really hasn't changed with the Panadol. It's still about 6 out of 10.
Okay, so
It's quite bad.
would you like some tramadol as well?
Yes, thanks.
Okay, so we're going to give 50 milligrams of tramadol. We're going to drug check that. Okay, so here you go. Yeah.
Thanks.
So you don't have pain radiating down your legs?
No.
You don't have a history of cancer?
No.
Or cancer at the moment? No. Are you taking any steroids or any chemotherapy medicines?
No.
And the pain is better when you lie down?
Absolutely, yeah.
Yeah. Has there been any recent unplanned weight loss?
No.
Okay. Again, there's no altered sensation or power in legs. There's no pain radiating down the legs.
No.
Do you have any osteoporosis?
No.
Okay. Or what about, have you ever been an IV drug user?
No.
Okay. So, we don't have any red or orange flags. We're going to leave you at home, if that's fine with you.
Yeah.
We'll get you to see your GP tomorrow morning.
Yeah, okay.
So we've fully assessed the patient, including a set of vitals. Appropriate investigations have been undertaken. None of the vitals are significantly abnormal. Serious illness or injury has been excluded, so we've just got a mechanical back pain here. No red flags are present. The patient has been able to mobilise. We'll try to get you to walk before we leave, just so that we know that you can walk, okay?
Yeah.
We'll just wait for that pain relief to kick in. Do you have any pain relief that you could take yourself?
Yeah, I've got some Panadol and some Nurofen there.
Okay. And if the pain gets worse or you feel that you can't cope, feel free to call us back. Okay, and we're going to leave you, a PRF with you, so it's just a form that states what we've done today and what we've found, okay? So do you think you'd be able to drive yourself to the GP or have somebody drive you to the GP in the morning?
Yeah, I could, yeah.
Okay, right. Rightio, we're going to a 51-year-old male who is injured their ankle. There is no abnormality in the primary survey and all vitals are within normal bounds. Okay, so hello, my name's Aidan. What happened today?
I was walking on the road and I went into a pothole and I rolled my ankle.
Okay. And which way did your ankle?
It sort of went inwards.
Okay.
Yeah.
And do you have any pain at the moment?
Yeah, it's really, really sore on the outside of my ankle, just down here.
Did you hear any noises or any funny things happened when you...
No.
And on a scale of 0 to 10, 10 being the worst pain you've ever felt, 0 being no pain at all, what would the pain be at the moment?
It's about 5 or 6. It's quite sore.
Have you taken any pain relief?
No, I haven't.
Okay. Are you allergic to any pain relief?
No.
Okay. Would you like some pain relief?
Yeah, it'd be good.
Okay, so how much do you weigh?
85 kg.
Okay, so we can give you 1.5 grams of paracetamol and 600 milligrams of ibuprofen. So I'll check those now. Alright, got my drugs and I've given them to you.
Sure.
A glass of water. Okay, so where exactly is the pain?
So it's right over around my knobby bit on the outside of the ankle.
Okay. And is there anything that makes it better or anything that makes it worse?
And if I don't walk on it, it's better.
Are you able to walk?
I was very, very sore, but I can walk on it.
You can walk, okay.
Yeah.
Right, so I'm just going to assess your ankle. Is there any pain up here?
No.
What about down here?
No.
Okay. What about on this side?
No.
Okay. So, is there any tenderness there? Any pain?
No.
Okay. What about any pain down here?
No, that seems alright.
What about over here?
No.
Okay, so
It's not just on the outside there.
yeah, so we can exclude Ottawa ankle rules and Ottawa foot rules. So I don't think we need an X-ray.
Okay.
We'll just assess the distal baseline. So can we just take the other shoe off?
Sure.
And so they're the same colour, same warmth. Pedal pulses are both present. Check capillary refill time. Yep. Same in both feet, less than 2 seconds. So I'm comfortable that there's no neurovascular injury here. So can you just show me that you can walk around? You able to do that for me? Okay. That's fine. So, what we're going to do, because this doesn't need to be seen by a doctor, we can just leave you at home.
Mm-hmm.
So what we're going to do is we're going to leave you with a plan, and we're going to get you to do a thing called RICE, which is rest, ice, compression, elevation. So what we want you to do is just rest, make sure that you don't use your ankle.
Mm-hmm.
We're going to get you to put some ice on it just for 15 minutes or so, you know, and if the pain comes back you can reapply that every now and then. And then we'll put a bandage on it just to put some compression on it, and you can put some Vaseline and stuff on it if you want as well. And then we want you to elevate it as well.
Sure, so you said every now and then. What do you mean by that?
They say about 15 minutes of every hour you can spend.
Okay, so every hour.
Yeah, just make sure you don't overdo it with the ice. So now we'll check our non-transport checklist.
So how do I compress it?
We can put a bandage on it,
Okay.
and we'll show you how to do that.
Sure.
Yep. And if the pain gets any worse and you feel like you're not coping, feel free to call us back, or you can go see your GP if you feel comfortable with doing that. Okay, so the patient has been fully assessed, including a set of vital signs. None of the vital signs are significantly abnormal. Serious illness and injury has been reasonably excluded. No red flags are present. The patient has been seen to mobilise. They have normal sensation and feeling in their feet. The patient has been given an explanation of when to seek further help, and the PRF is being completed and a copy being sent to the patient. Aidan Davey responding to a 51-year-old male complaining of headache. All vitals are within normal bounds. Hello, my name is Aidan. What seems to be the problem today?
I've got this terrible headache.
And when did that start?
Oh, about an hour and a half ago.
Okay, and have you had headaches like this before?
Oh, about 10 years ago I had a similar headache, yeah.
Okay. And how long did that one last for?
Oh, it lasted for about 4 or 5 hours. It was horrible.
Okay. Did you see a GP about it?
Yeah.
So at the moment, where exactly is the headache?
So it's sort of just on this side of the head. It's just...
Just the right side of the head?
Yeah. It's
Okay.
just,
And can you describe the pain to me?
it's throbbing. You know,
Throbbing?
it's just... It's really uncomfortable.
And does it spread anywhere?
Not really. It's just sort of on that half of the head.
Okay. And on a scale of 0 to 10, 10 being the worst pain ever, 0 being no pain at all, what would the pain be at the moment for you?
It's an 8 or a 9. It's pretty
8 or a 9.
horrible, yeah.
Okay. And have you been vomiting at all?
No, but I do feel as if I'm about to.
Okay.
I had a wee bit of a dry reach before,
Okay.
but I didn't vomit. But I really feel as if I'm going to be sick.
Okay, so we can give you some ondansetron. We'll give you 4 milligrams to start with. It's just a little tablet. We'll put it in your mouth and it just dissolves under your tongue. It will just help with the nausea, okay?
Thanks.
So, drug check. Give some ondansetron. And would you like any pain relief?
Well, I did take 3 Panadol about an hour ago.
Okay, so we shouldn't be giving you any pain relief. Have you had any ibuprofen?
No, I haven't.
Okay, we'll give you some ibuprofen. Are you allergic to ibuprofen?
No, I'm not.
Okay. So we'll give 600 milligrams of ibuprofen. The patient is above 80 kilos. So we'll drug check that again. Good for that.
Thanks.
Okay, so have you noticed any visual disturbances?
Right at the very start, I saw these sort of wavy-like things, like water running across my eyes.
Okay.
Yeah.
And I'm just going to look at your face just to see if there's any pain there. So, do you feel any pain there?
No.
What about up here?
No, not really, no.
What about in your jaw?
No.
What about if you're chewing? Or can you smile? Yeah. Does that cause any pain?
No, it doesn't.
Yeah. Could you shrug your shoulders for me? Okay. So, do you know what this is?
It's a torch.
Yeah. I'm just going to look in your eyes, okay? Is that painful at all?
No. Oh, a wee bit.
Okay.
Yeah, the bright light
Yeah.
does hurt a bit.
Okay. Could you just look at this and just follow it around? Yeah. And can you So could you give me a big smile? Yep, big smile. And now, can you just raise your arms out like that, and then close your eyes? You're not seeing any signs of pronated drift, so you can just open your eyes and go back down. Can you say the quick brown fox jumped over the lazy dog?
The quick brown fox jumped over the quick lazy dog.
Okay. Do you know what this is?
It's a pen.
That's a pen. Do you know what this is?
That is a Sony cell phone.
Yeah. And when did... so it started about an hour ago?
Yeah, an hour and a half ago.
And you were fine before that?
Yeah.
Okay. So we just did a fast test, so we don't think you're having a stroke. And we've done a couple of cranial nerve assessments. Have you noticed any changes in your hearing? Any like ringing or anything coming on?
No.
Okay.
No.
And what about, have you noticed that your taste is a bit different?
Well, I just don't feel like eating. I feel nausea. That tablet's helped a wee bit.
Okay.
Yeah.
So does anything make the pain worse or make the pain better?
The noise. So you asking these questions is quite. It's making my pain worse.
Sorry about that. And does your family have a history of these sort of headaches?
No.
No?
I just had one before.
Just one before?
I went and saw the doctor.
Yeah. And has it limited you from doing anything?
Well, I can't do a thing.
Okay.
I mean, I'm stuck on the couch.
Yeah.
I really would like those blinds closed
Yeah.
again.
Okay, so we'll do that, and we'll put you in a nice dark room, and we'll just get you to lie down, and we'll see if that helps.
You don't have to do that. Thank you.
Okay. So this has the symptoms of a migraine.
Yeah.
So
I think that's what the doctor said. He thought it might have been,
Yeah.
but I hadn't had enough of them.
So you've got a unilateral headache, you've got an aura, and you've got vomiting. So I'm happy to leave you at home if you're comfortable with that.
The nausea's feeling a bit better now.
Okay. So I'm just going to go check my red flags just to see if make sure we've got no serious problems.
Mm.
So are you able to move your neck? Does that cause pain?
No.
What about if I just touch you there? Does that
No,
cause you
no
pain?
pain.
No pain? No. And you don't have any stiffness in your neck?
No.
So the headache was slow onset. You don't have a temperature. You don't have persistent severe vomiting. There's no focal neurological signs. There might be a bit of visual disturbance associated, but it seems to have dissipated now.
Yeah.
The level of consciousness is good. You have any recent trauma to the head?
No.
And you're not taking any medication, so not taking an anticoagulant.
No.
There isn't any signs of temporal arteritis. You're not pregnant. You're not a female. Have you had any history of bleeding in your brain? Do you have a family history of any bleeding in the brain or associated brain conditions?
No. So you said temporal arteritis. How would you know that I had that?
Oh, it's inflammation of the arteries supplying the temporal lobe. So you'll notice a very prominent artery sticking out here, and it will typically lose its pulse. But your one's fine. I can see it through the pulse. It's not protruding out too far.
Mm-hmm.
So no, you're not pregnant. You don't have a previous history of any brain bleeds.
No.
You don't have a family history of any vasculature brain problems.
No.
And there's no onset during sexual activity, was it? No.
Right, so.
And so you don't have any symptoms associated with sinusitis, which is just inflammation of the sinuses, which generally have a lot of pressure on the front of your face there. And it sounds like you've got migraine symptoms, but you haven't had any migraines in the past, so
I've just had one.
we'll get you to check up with your doctor,
Okay.
with your GP, yeah, and you can do that tomorrow morning, that'll be fine.
Okay.
So we're just going to do the non-transport pause and checklist. We're going to reassess our vitals. And what's your pain at the moment?
Well, it's come down to about a 6 now,
A 6, okay.
and the nausea's gone.
Yeah. And so you obviously have paracetamol here. Do you have any ibuprofen here as well?
No, but I can get my wife to bring some.
Okay, so we'll get her to do that, eh? And so we'll complete our non-transport pause and checklist, and then we'll be done. document all of that on the PRF. So we've been called to a 51-year-old male with a spontaneous nosebleed. There was about 200 mils of blood loss that we've estimated from the patient's towel that he's bled into. The patient is not on any anticoagulants. The only medication he is taking is aspirin. There is no head trauma involved, and there's no recent surgery, but we should still assess for a septal hematoma, and vitals are all within normal bounds. So this is going to be an assessment of our epistaxis. Mario, hello there. Can I just take a look up your nose?
Sure.
Right, so I don't see any signs of septal hematoma. Can I just get you to lean forward,
Sure.
and apply pressure to the front of your nose for 15 minutes. Okay. So when did this bleeding start?
Oh, about 45 minutes ago.
45 minutes ago. And have you ever had it before?
Yeah, about 3 or 4 times in the last year.
And what happened with those nosebleeds?
Well, I saw the GP and he said I had to have my nose cauterised, but I haven't had that done yet.
Okay, and did they self-resolve, or did you have to get them?
Oh, I had to go to the GP on the last one. He packed it and did some stuff.
Right. Okay. So we're going to wait 15 minutes, and then we're going to reassess your nose to see if you're still bleeding. So in the meantime, we're going to take a set of vitals. Now we're going to fast forward 15 minutes, and so we're just going to re-look at your nose. So if you could just release.
Still bleeding.
Yeah, it's still bleeding. Okay, so you just apply the pressure again. We're going to give you something called intranasal adrenaline. We're going to just use this little device to squirt some adrenaline into your nose.
Oh, yeah.
It's going to just vasoconstrict, which just tightens up the vessels in your nose, and hopefully will allow them to clot so that they stop bleeding. We will need you to blow out the clots, and I'll give you a tissue to do that, and then we need to squirt this up your nose as you're sniffing in, okay? Some of the side effects of adrenaline, it can cause an increase in heart rate, and it might give you a bit of a headache. So would you like me to do that?
Sure.
Okay, so we've got a 10ml syringe here. We're going to draw up our adrenaline. First we're going to put in 9 mils of normal saline. We're then going to have our adrenaline, which we will drug check. In date, correct dose, it's adrenaline. We're going to add that 1 milligram into the syringe here, which is going to give us a 1 in 10,000 adrenaline dilution. We're going to give 0.2 milligrams up each nostril because it is a bilateral nosebleed. So right, we're just going to give this now, okay? Just need you to take the pressure off your nose and blow the clots out, yeah? Now I'm going to put this up your nose and I'm going to start squirting and you just sniff in, okay? So 2 mils, yep, in that nose, and 2 mils in that nose. There we go, and just apply pressure again. Okay, we're going to wait another 15 minutes, and we're going to reassess if it's still bleeding then. If it is still bleeding then, I'm going to give you a firm recommendation that we go to ED and get it sorted out there, because it may be a posterior nosebleed or uncontrolled. If it is controlled, then we may just we may let you stay home and we'll just tell you to go get a checkup with your GP. If we do that, you will have to avoid having hot showers, hot drinks and stuff like that, okay?
For how long?
I'd say at least 24 hours. Fast forward 15 minutes. And are we still bleeding?
No.
No, we're not bleeding. Okay, so we've assessed the nose and it is not bleeding anymore. We're going to take a set of vital signs. We've recorded the time that we've given the adrenaline. We are going to do a non-transport pause and checklist as we can leave this patient at home. We're going to give you the advice that you need to go see your GP tomorrow. You also need to avoid having hot showers, hot drinks or blowing your nose for at least the next 24 hours, okay? So the patient has been fully assessed, including a set of vital signs and appropriate investigations. None of the vital signs are significantly abnormal. Serious illness or injury has been excluded. No red flags are present. The patient has been seen to mobilise, so can we get you to walk around, Yeah, awesome. The PRF has been completed, including the time that we give adrenaline, and a copy is being left with our patient.